Hello, this is Dr. Howard Toler. She's a medical doctor at Bedford Memorial Hospital, and I'm doing my interview with her for my Anatomy and Physiology 2 project. Dr. Toler, can you give us some information about yourself, like how long have you been working here?
Yes. I've been working here since winter of 2010, and I started as what we call a locum tenens, where I kind of just fill in and help out, and then became a permanent employee in August of 2011.
Okay. What made you want to go into this field to be a medical doctor?
I had wanted to be a doctor ever since I was a little girl, and I entered and won multiple science fairs and did various projects that I would have in school in science and, say, language or medical topics. And then when I was 17, I had my first child, and pretty much my mom encouraged me to go to school to do something quicker. So I started an education program and actually fell in love with it. And so I taught elementary school, and trained teachers for 10 years. And then as the education field started changing, and kids were having more diagnoses such as ADHD, ADD, and they were having full inclusion in the classroom, it started making me think more about medicine and education and how the two fields needed to work together. So I applied to medical school and actually was accepted the first time and started in the year 2000, and I've been a physician ever since.
Okay. Now, what is the most I know being a doctor, well, working in the medical field, period, as a nurse, a doctor can be stressful. What is the most stressful part about your job?
Probably helping a patient and a family accept a terminal diagnosis, or as a patient is passing, and you know that this experience that you have with this patient will not be repeated again, because they'll probably be dying in the next day or so.
Okay. Now, what is the most fun part about your job? Most rewarding part?
Well, the relationships. Like, I wouldn't have met you, Robin.
Okay.
So the relationships with my patients' families, the patients, as well as the support team, nurses, administration, because you have a big impact on people, and you don't realize it. And so that is one of the most rewarding, for people to, thank you, or send you a card and say they appreciate you helping them, even though you may not realize how much you have.
Okay. Now, what advice would you give someone who wants to maybe be a medical doctor or go into the medical field?
I would say clean your plate. Try to eliminate extra things such as second, third, fourth jobs. Try to have your family financially and emotionally organized, because it's going to take so much of your time. And definitely to study.
Okay. Now, I'm doing my project on depression. And my professor, he would probably, I thought I would do it with you, because psychiatrists, I've been to plenty of psychiatrists, and they don't really spend enough time to really get to know you. All they want to do is just write the prescription and say, well, if you got a problem, talk to your therapist, I'm out of here. And I know a lot of people, they get a lot of sicknesses and illnesses like blood pressure, ulcers, things I'm thinking could be related to stress, depression. Do you have any words that you would like to offer on depression?
I would. Depression, unfortunately, is one of those diagnoses that has a bad connotation to most people, when it's just a disease like anything else. So a lot of times people who have not been diagnosed with depression are not getting treated, but they're still depressed. And we call that subclinical depression. You're working every day, you're doing everything, you're managing everything, but you know something is missing. Those people still require treatment, and unfortunately, because of the stigma associated with depression, and like you said, not having enough time to actually talk to someone to find out what those triggers are, leads to millions of people going undiagnosed. And then unfortunately, that comes up in disease. They can also crash into the brick wall and suffer from overdose, and actually just dysfunction such as divorce, bad relationships. And so my hope is that I discuss things with patients, I validate whatever disease they have so that they are welcome in treatment.
Well, Dr. Toler, thank you for taking the time to let me interview you, because I know you're a very busy woman. So thank you once again.
I consider it a privilege. Thank you, Robin, and good luck in your studies.
Thank you.